Peace and blessings, everyone. Welcome to another evening of Spotlight here on JTV Channel 55. I'm Edjuenka, and we have a very important and informative program for you this evening again, packed as usual. You know, many of us have elderly parents, and sometimes we are human, so we get a little upset about some of the things that they do. Sometimes we get a lot upset about some of the things that they do, and we sometimes mistreat them or ill-treat them, not realizing that they may have a certain type of illness, particularly Alzheimer's. And that is mainly because we have not heard a lot about it here in the Virgin Islands. We've not becoming more aware of it. It's something that we watch on television, something we hear in the States and in Europe, but we haven't been paying a lot of attention to it here in the Virgin Islands. But now we begin to recognize that Alzheimer's is with us, and there are many of our parents, our elderly, who have Alzheimer's, and we need to know what it is. We need to know what the symptoms are. We need to know what the treatments are, and we need to know how to care for our elderly and make them more comfortable and be able to enjoy them while they enjoy the waning years of their lives. And so tonight we're going to have a great discussion about Alzheimer's and the symptoms, and we have a short film to explain what these symptoms are and how we should behave as caregivers of persons with Alzheimer's. So that's one important segment of the program tonight that you need to stay tuned for. We're going to be talking to Rotarians tonight. We got, I think, 3 different clubs here tonight talking about some really interesting upcoming events. I don't know how many of you remember the Rotary used to put on a concert in the cultural center where some of the men used to dress up like women. Well, it's going to be an interesting discussion. So we're going to talk a little bit about that upcoming concert. And Rotary Club, one of the Rotary clubs is celebrating its 25th anniversary. And a very interesting and entertaining guest will be coming to the BVI. So we're going to talk a little about that. And we have a group of young men that will be performing at the Stick It in the days ahead, bringing Christmas spirit to Long Look, to the Stick It in Long Look. The young men Christmas chorale. We have members going to be here tonight talking about what's coming up with that concert, and all the people all the young men that's going to be performing at that concert. So it's going to be a really interesting program. Sean Rose is on vacation, and so we're going to go directly to our guests. And first, of course, we want to talk to, we're going to be talking to our good brother, Lyons Kevin Malone. Welcome to Spotlight. Good to see you.
It is exciting being here again.
And of course, President of Rotary Club of Rotown, Ryan Gullick, is no stranger to us, and he's going to be talking about the relationship, the campaign, the awareness campaign that's going on, that's taking place between the Lions and the Rotarians, which is an interesting combination.
We do work together.
Good to see you. Good to see you, Ryan, again.
It's good to be back again. So.
Yeah. Well, let's first start about how this concept come about, where you have the 2 major clubs in the Virgin Islands teaming up together, not competing, but actually teaming up to bring awareness to the community regarding the dreaded disease of Alzheimer's.
Well, sorry.
I was going to say, I mean, it's working together between Lions and Rotary isn't something new to us, but certainly the whole concept of the partnership with Lions and Rotary, I guess, started somewhere around 2012 when our current district governor, our past district governor, Vance Lewis, was district governor at that time, and Brother Carvin's district governor, who was, I think it was Claudius
Boncampo, yes.
Boncampo, who was district governor, and they got together and signed a memorandum of understanding to partner together to try to spread, I guess, advocacy and knowledge about Alzheimer's as a disease, and get people more aware as to what the effects are, and really early detection and awareness of Alzheimer's. So that sort of concept all started at that time, and then we've sort of built on it this year and trying to work together.
What is the vision and the activities around the campaign of Alzheimer's awareness? And
Well-
how long is this campaign going to last?
First of all, you would hear a lot more and the actual specifics of it, but it is important for us to note that as service organizations, it is imperative that we do whatever is possible. The whole dreaded disease of Alzheimer's is one in which is bigger than any one organization, one club, one group. And in actually St. Martin, they have done extensive amount of work there already. And you would hear more about this, the work that has been done already by the Rotary Club of Rotown through a very special advocate, Edna Williams, and she has been quite vocal and instrumental in getting the awareness out. Government themselves have done a number of programs in terms of making sure that the populace know that there is help. Help is on the way. And when we have the opportunity to joint venture in events like these, we find it special. So there are a number of activities. You'll remember that in the park just about 2 months ago, we had the candlelight visual, and there are a number of other programs, as I mentioned, that you would hear more about. But I'm just dropping by to state that we have a very difficult task ahead of us, because there are a number of families that live and operate in denial. It is almost one of those areas where if you're not aware as to the pervasiveness of it in terms of how many cases, you might feel that you're out there alone. But you would hear more and more tonight that it is more prevalent here than a lot of people are prepared to.
So
give heed to.
are we in denial, or is it just that we just don't know? We don't know how to recognize it. You know, we might think that, oh, well, you know, you're just forgetful, or, you know, your mother or your father are playing games with you. You know, sometimes elderly may want attention, and they might act in a certain way to attract that attention, and we might feel that that's what they're doing. Is it something that we are unable to recognize presently, and it's not so much that we're in denial?
Well, I think that's one of the big things that we're trying to bring out is I agree with you. I don't think it's necessarily denial. I think a lot of it is either misinformation or not really recognizing what the symptoms are. So big part of this campaign is trying to bring increased awareness of what those symptoms really are. I mean, we've done press articles already in the papers, and we'll be doing a lot more of those going forward, specifically looking at those symptoms and trying to show what those areas are that people need to watch out for, because with any medical illnesses, the earlier you can detect it, the more you can treat it. I mean, there isn't necessarily a cure for Alzheimer's right now as yet, but there is studies that show that if it's detected early enough, that it can be treated effectively and the symptoms can be slowed down. So that's really one of the big things that we're trying to bring about is that the early detection area is so important here in the BVI, that if we can get people to detect it earlier and get the medical practitioners to detect the symptoms and family members to see that there is something wrong, we're hoping that it will help to improve the quality of life of those people who are suffering from it, and the families and friends.
Is there any available data that say, you know, how prevalent it is, and that caused the motivation for the two clubs to come together in such a meaningful way to advocate for awareness and to make people alert to the prevalence of the disease and what they need to do in order to help their loved ones to deal with that?
Well, I think Dr. Samuels will speak a lot more probably on that, but I think that's one of the major probably black holes, I guess, here in the BVI and really around the Caribbean, is that there isn't a lot of data in a lot of the countries. So it's very difficult to act within the Caribbean, but there is definitely research that we've seen and that we've been given with regards to how that it is definitely a widespread disease around the Caribbean, and something that needs to be paid attention to.
Okay.
Yeah, I would actually dare say that there's hardly a family without some effect of Alzheimer's. They're members in the family. I know firsthand of it, family members. I know of employees who currently have members of their family there. You would hear some more about that tonight, but I would dare say that, yes, we don't have a registry of numbers and members, but the fact is that if you were to take an honest census of families affected by it, it will be quite a large number.
Okay. We have a short film, a 3-minute film, and I want to get to that. I want to give the viewing audience a understanding, a deeper understanding of what Alzheimer's really is, so they could be able to identify the symptoms. They could perhaps start to recognize in their environment what's going on with their family members, and so they will be able to mitigate the circumstances in a much more confident way. So we're going to go to that film, and when we come back, we're going to come back with Dr. Samuels and a couple of members of the community, with family members who have Alzheimer's, so that they could give us some first-hand experience of some of the challenges that they face and what needs to be done in order for them to have, for their families to enjoy their loved ones in that circumstance in a better way. So we're gonna go to the film and come right back with Dr. Samuel, Ms. Jeanette Boynes, and Mr. Alan Blyden. Of course, Dr. Samuel is the Chief of Medical Staff of People's Hospital. Ms. Boynes is the current president of Rotary Sunrise and has a mother with Alzheimer's, and Mr. Blyden, Alan Blyden, also has a mother with Alzheimer's, and they're going to be joining us, and we're going to talk some more about what it actually is right after we look at this short film.
What is Alzheimer's disease? Alzheimer's is a slow, fatal disease of the brain affecting 1 in 10 people over the age of 65. No one is immune. The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few hours or days ago that the rest of us might take for granted are just not there. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain where language is processed. When that happens, it gets tougher and tougher to find the right word. Next, the disease creeps toward the front of the brain, where logical thought takes place. Very gradually, a person begins to lose the ability to solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination, and in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from mild forgetting to death is slow and steady, and takes place over an average of 8 to 10 years. It is relentless and, for now, incurable. Helping your family, friends, and neighbors to better understand Alzheimer's will reduce stigma, improve care, and even help the fight for a cure. Thanks for helping to do your part. Learn more at www.aboutalz.org.
Yes, welcome back to Spotlight. I've been joined by Mrs. Jeanette Boynes. She's the president of Rotary Club Sunrise, Dr. June Samuels, the chief of medical staff of People's Hospital, and Mr. Alan Blyden. So also a person whose mother has Alzheimer's, as well as Ms. Boynes. I should have mentioned that. Welcome to Spotlight.
Thank you.
Good to have you. Yeah. I want to start with you, Dr. Samuel, of course. You've had, as a psychiatrist,
Right.
you must have come across quite a few persons suffering from Alzheimer's. You have a sense of how prevalent it is in the Virgin Islands?
So one of the things that we have some challenges with, of course, is our data. We're currently working together with social development to develop, hopefully, a central registry so that we can collate all of the information. So we don't have any hard information on the numbers. But from a clinical perspective, having worked in the BVI now for more than 10 years as a psychiatrist, we do have a growing problem with Alzheimer's and dementias, and it is not anything that's unique to the BVI. It is a worldwide problem. Persons are living longer. As we live longer, this is one of those conditions that can show up as we age. In addition to that, we're now recognizing that some of the risk factors for developing Alzheimer's and dementias, Alzheimer's being one type of dementia, are also linked to some of the risk factors associated with chronic diseases. So high blood pressure, diabetes, strokes, those kinds of risk factors. Persons who have that profile are also high risk for.
So is it partly a nutritional problem?
It may, indirectly, partly a nutritional problem because of the chronic diseases or lifestyle
choices.
Yes, or lifestyle choices. And it's also a genetic issue because we know that Alzheimer's runs in families. We don't understand exactly how it does that, but we do know that it does. If you have a family member, then you yourself are at risk.
Okay. Now, what are some of the social and economic challenges that we find can be presented with persons with Alzheimer's? How does it impact the community?
I guess the biggest impact is around the issues of care. Because these patients should have specialized interventions, certain types of resources allocated to providing the care. As the disease progresses, it requires more and more resources. It's one of those conditions that if you experience it, it's something else to experience because you see the complete reversal from being a healthy functioning adult right back to just as you were when you were a baby first born. I mean, it's a complete reversal of that whole process. So persons end up being totally, bedridden, dependent. You have to provide complete care. So that's one issue. In the BVI, our culture hasn't been one where we tend to, for me this is a pet peeve, so I'll talk about it now. We haven't had a culture where we tend to plan our lives and plan for, what can happen to us if we become unwell or become ill. So for patients who develop Alzheimer's or any type of dementia, the whole issue of planning, financial planning, your will, determining how you want your assets and so on to be handled. That is a particular challenge I find with most of the patients that I've worked with that you run into, and a lot of it is linked to, you know, by the time patients present, because we think that, oh, as you grow older you will naturally lose your memory, which is not so, but by the time they present, you know, they may be in mid to advanced stages of dementia and then are unable to participate in that process.
No, I know we had a chance to look at the film, but I think we need to go over it again. What are we looking for at the early stages? Because it seems, first of all, preventable, and it seems now treatable when you start talking in terms of its relationship to chronic disease and the same risk factors being presented. What are we looking for? How do we already detect?
So one of the things I want to get rid of the misconception that we have that this is a disease of the elderly. That's not true.
Oh, okay.
You know, it is a disease of the majority of persons are over 65, but the youngest patient I've had in the BVI was 50. So the very early stages of dementia will present with memory loss, which shows itself in the persons usually repeating themselves. So they will ask you a question and then come back and ask you the same question. There's some research now that shows that even prior to that, you may notice a change in the individual's personality. So whatever your normal personality was, there's a change. And typically, the persons become more socially inappropriate. They make jokes that are off color. Has been one particular symptom that has been noted recently released research as a sign that you should look at, have those persons looked at. So initially it is change in personality and loss of memory, and then it progresses you know, more into, they become more confused, gradual loss of memory, and then as you progress, it starts from your higher functioning first is your short-term memory, so your working memory. So one of the things you will notice is that persons will be able to tell you everything about their past life and their childhood, and you know, they can tell you that, but they wouldn't remember something that you told them just 3 minutes ago. Okay, and then it progresses. It slowly affects the language function. It affects you physically, eventually until you lose the ability to walk, you become bedridden, and at the end stage you lose your ability even to eat, to swallow. So sometimes patients end up with feeding tubes.
Okay. Jeanette, your mom suffers with Alzheimer's. For how long now?
I would think that over the last 5 years, we did see the change in personality, the change in lifestyle, the repetition in terms of asking the same thing
over and over.
So we saw it coming on gradually until it became full-blown.
Were you able to recognize it in the family, to recognize that something was wrong and that you needed to pay special attention to it?
Yes, we did, and we tried to pay special attention to it by going to the doctors and stuff. My mom at that time was almost 80, and I think one of the suggestions or from the doctor was, you know, at that age, you tend to just make that person comfortable, and that's what we decided to do.
How has the experience affected your family, and what sort of things you do, you know, your brothers and sisters and your extended family do to make your mom comfortable and for you all to enjoy her? Because I know that I'm a personal friend, so I know that you all enjoy your mom.
We definitely do,
despite what, you know, the illness.
So some of the things, first of all, we stay close to her. We have the great grandchildren. We have educated them on, you know, what is going on. So if mom is not happy or if she's grouchy today, you should understand that that's not mom, you know. So they are very kind towards her, very loving. We have lunch with her just about every day. Well, every day we have lunch with her. The family would get together very often. The house is there's always someone there. We will have Sunday, fourth Sunday, we would have family lunch. We take her for drives. We make sure that she's comfortable. She likes ice cream. So when we want her to do something that she doesn't want to do, then we bribe her. If you do this, we're gonna take you to get ice cream, and it works. You know, I think she's a very passive person, not very aggressive, so it's very easy for us. And we just use the humor to help us to get over the hump. You know, there's certain things.
So sometimes she's funny.
Right,
And she
you
acts
know,
in a
there's
funny
certain
way, and
things
you
that
go along with it.
certain situations, so we just turn it into humor, and we, you know, we are enjoying. As they say, if you get lemon, you make lemonade. So we're enjoying the lemonade, and we are just making her comfortable. That's the most important thing, to make her comfortable, to make sure that someone is there all the time, so that she doesn't get the anxiety syndrome, you know, wake up and nobody is there,
depressed
or
and-
depressed and things like that. So we work with that. I have the support of my siblings, you know, and we take turns in presenting the proper care to her.
Yes, that sounds good. But Bladen, your mom has Alzheimer's as well. How long has she had it?
I would say she has had it now for about 8 or 9 years.
How old is she?
She will be 88 in next week, actually the 20th. She makes her 88th birthday.
Okay. And how have you been, you and your family been managing and coping with that situation? What's your experience has been like?
Well, initially it was a challenge, particularly when she started having symptoms such as she would get up and just wander. And she would talk about going to visit someone that I don't even know, because it's someone from the past, from her past. Maybe when she was a child and she'd
Someone had died?
Someone that had died a long time ago. And she would always be talking about, well, I'm going to visit this person, or I talked to this person, and I would be like, who is this person? You know, so for me that was challenging. And also when sometimes she would lose her memory in terms of she would not know who we are. So we would come to visit her and she was like, who is this person? So you know, that was challenging for me.
Were you already able to recognize Alzheimer's at that time? Did you have the information that you needed to identify some of the symptoms that was presenting?
Well, I think initially what prompted us to really seek attention, medical attention, because she lived alone. My mother has always been an independent person. And when my father died, she was basically living on her own. So what prompted us to really seek medical attention was when she started these wandering offs, going places, and we would find her maybe somewhere walking. And she would be saying stuff like she's going to Carrot Bay. She was raised in Carrot Bay, but she lived in King Garden Bay. So obviously she can't walk to Carrot Bay. But
Right.
she would be, as if she's going there, she would say stuff like she's going home, because she was raised in Carrot Bay. But you know, living in King Garden Bay, and she's going home because that's where she thinks she lives. You know, so we like, something has to be wrong with this picture.
And so after you got the medical attention and the diagnosis, and you understood what was happening, what was the reaction, and what was the experience, and what is the experience like now with her?
Well, I've never really known someone with Alzheimer's. I've always heard about it, and the only thing that I basically knew about it was that people lose their memory. But in terms of the different progression, the different stages of progression, I never really paid attention to it. I guess it's like you don't really know what's going on until it hits your front porch, so to speak. So after she started having these wanderings, we really got concerned, and we came together as a family and sought the medical attention, which was great. And then we learned, obviously, more about the Alzheimer's itself and what are some of the other symptoms, so that we could have identified and be able to, cope with what was going on. But after we, found out what was going on, it was much easier to cope and to deal with the symptoms.
Knowledge was really helpful.
Yes. As I said before, I did not know, because I never knew anyone with Alzheimer's until my mother experienced it.
Okay. Now, the way forward in terms of how the society is going to deal with Alzheimer's, Dr. Samuel, what needs to happen? A collaboration between what sectors of the society, and how do we deal with it from a social, cultural, economic perspective?
So I have to say I really appreciate this initiative that the Rotary Club is taking on, because it is something in the BVI, we are living longer, and the statistic says that there's one new case every 3 seconds. So We expect that we're going to have more of a problem, and given our chronic disease issues we have now, we expect that we're going to be seeing more dementias. So it needs a collaboration between both the public and the private sector, because we really shouldn't depend on government to do it all. At the ministry level, I know one of the things that's being worked on is a healthy aging policy, and as a part of that, we're trying to put dementia as one of the key areas to be addressed because of the resources that need to go into providing particularly the care and the support. We're also looking at currently in the BVI, I would say that we're in a good place when it comes to doing the assessments and making the diagnosis. We could be in a better place in terms of the medication treatments that are offered. Currently, the medications are fairly expensive and they're only available in the private sector. I'm sure that will change by January 1st. So that more persons will have access. So on that front, we're not doing too badly. But where we're very weak and have a lot of gaps is in the caregiving and the support. We're looking to improve.
And education as well?
Yeah, so education. So we're looking to improve on, caregivers who are specifically trained to provide care for patients with dementias, because it's not like caring for an elderly person. It's caring for someone who is living in their own world, can be confused, can be, have mood changes, there can be various types of challenges, and there are specific interventions that have been researched that we know work. So we want to really get to a place where we can provide programs that persons can go to. In our community, Jeanette and Alan have really good family support. We have families here who struggle because they don't have that extended family, and what to do with the person in the day can really be a challenge. At the hospital, at the acute unit that we have, we've been providing some day program type of assistance. Social development is also looking at developing their programs so that patients can have places during the day to go to. And then on the other end, which for me is key, is the support for the relatives. I lived through my grandmother having Alzheimer's as well, and I'm telling you, it can be a burden. Caregivers get burnt out, they get depressed, and you have to deal with seeing your relative, basically slowly disappear in front of your eyes while they're alive. It can be a painful experience, and different people handle that differently. So that support for the caregivers and the relatives is also important. So that's the spectrum. The education as well, because one of the things I'm hoping will come out of this is that we will get to early diagnosis. Early diagnosis is key, right? Because persons can be diagnosed early, get on treatment, and continue to work if they're still in their working phases of their life. It prolongs the length of time that they live with the condition.
Is there a place now where persons can access some kind of support, even if it's just counseling, a telephone number or some way where you could call up and get advice if you see a symptom presented in one of your elderly parents or somebody you could call and get some sort of support, educational.
So they can find that through social development. That's 4943431. Through the mental health services, BVI Health Services Authority. I provide some of those services. That's 4946757. And then we have in the BVI, we have BVI Alzheimer's Awareness Group. So it's BVI ALZ Aware @gmail.com. So that will be circulated more, and it's on Vino. So you can go on Vino and you see the sign, you look for the purple sign, the Alzheimer's Awareness Advocate, and there's a lot of information on that website as well that persons can access. Your general practitioners should have the information as well. They may not all necessarily have it, but they will know who to refer you to. Typically you will end up seeing either a psychiatrist or psychologist to help to do the full assessment. One of the things I want to emphasize is that not because somebody's getting old and they're forgetful means it's normal. Okay, you really should have a full assessment done. There's a whole battery of tests, including CT scans, because sometimes something as simple as a brain tumor or stroke can present in this way, and therefore that has implications for the outcome at the end.
Dr. Samuel, I want to thank you very much for being my guest on Spotlight. We follow on the turn 8 o'clock. Jeanette, it's good to have you, and Brother Alan Blyden. Thanks for sharing your experiences with us, and I'm sure the viewing audience got a good understanding of some of the things that they should be looking for, and perhaps some advice on how to handle the situations as they present themselves. Thank you very much for being a guest on Spotlight. We're going to take a break for a word from our sponsors. When we come back, we're going to come back with Ms. Jeanette Boyens in her capacity as president of Rotary Sunrise, Rotary Club Sunrise, and we're going to be talking about the upcoming concert, upcoming Christmas concert that's going to be held at the Cultural Center. So you keep it locked right at the Spotlight. We'll be right back after these words from our sponsors.
Spotlight is brought to you by the National Bank of the Virgin Islands and CCT Global Communications.